In this portion, we will cover the joint disorders. So this is the second part of Chapter 9. First of all, we'll cover osteoarthritis, which is a degenerative disease. It's caused by normal wear and tear of the joints, and it usually happens in the weight-bearing joints, so in the knees and hips, and it's very common to happen in the small joints of the hand and then in the wrist. There is a genetic component that has been identified in mice, so it would be interesting to find out if that holds in humans as well. For the pathological and pathophysiological changes that happen in osteoarthritis, there is an erosion and destruction of the articular joints, and you can see here there's a decrease in the interarticular space with new bone formation, and that bone is called osteophytes or bone spurs, with the development of cysts in the bones. And all of this leads to that the bones are now in direct contact with each other, and they cause the pain. So you gotta have a vicious circle of pain, leading to more inflammation, and the inflammation leads to more pain, and so on. So these are that's the pathophysiology that we just talked about. The causes of osteoarthritis, the primary cause again is the normal wear and tear. Again, it tends to occur with the incidence increases with obesity and with increased age. The secondary form, though, that tends to happen at an earlier age is after a trauma or repetitive use of the joints, and there is actually an increased incidence of arthritis in the thumbs, and due to the texting phenomenon that we've been experiencing for the last couple of years. So there's also it was found that there's a spike in the osteoarthritis of the thumbs. And again, it happens in the weight-bearing joints, also the knees and the hips. Signs and symptoms of osteoarthritis would be the patient that comes in and they have pain, swelling, and even sometimes redness in the weight-bearing joints, so in the knees and the hips, sometimes in the smaller joints of the hands. There's usually morning stiffness, meaning that they wake up in the morning and these joints tend to be stiff. But as the morning stiffness doesn't last for long, so it lasts about 5 to 10 minutes, and then they're able to move their joints. Okay. As the difference between, just keep this in mind so that when we're talking about rheumatoid arthritis, we're going to contrast it and compare it to osteoarthritis. In osteoarthritis, pain is increased due to motion. So as you move, the pain becomes worse in osteoarthritis, which is a degenerative disease. Okay. There is a decrease or limitation because of the pain. The person's limited in their social activities. Walking tends to become difficult. If there's inflammation, osteoarthritis happening in the TMJ or the temporal mandibular joint, it becomes harder to talk and harder for them to eat, which can lead to malnutrition in older individuals. It can also lead to, because of the inflammation of the joints, sometimes they tend to become destroyed, or there is bony irregularities and enlargement of the DIPs. DIPs are the distal interphalangeal joints. For treatment, you can give them massage therapy. You want to treat the inflammation and the pain with nonsteroidals, anti-inflammatory drugs, physical therapy, occupational therapy. You could, if the arthritis is really bad, you might have to immobilize the joint for a while, put them maybe in a hand brace. Trials include injection of synthetic synovial fluid, or also known as hyaluronic acid. There's also glucosamine chondroitin supplements. These supplements are not 100% effective. They tend to work in some individuals and not others. The only thing that against it is that it's not a cheap treatment. Okay, it's a little bit costly, and then you have to take it for at least 6 months before you find out if it will even work on you or not. So it's kind of like you're taking that risk. Okay, you could sometimes inject cortisone in the joint directly, although multiple injections can worsen the arthritis. In conditions where it gets really bad, you can do surgical joint replacement. For rheumatoid arthritis, this is an autoimmune disorder. It is a chronic inflammatory disease, which sometimes is systemic, meaning that it affects joints and other parts of the body. Higher incidence in females, that it can affect all age groups, but it tends to be more common in middle-aged females. For the pathophysiological changes of rheumatoid arthritis, there is an inflammation of the synovial membrane, leading to thickening of the synovial membrane and pannus formation. And this leads to decrease in the space of the joints. There is also decrease in the amount of the synovial fluid being made. And because of the destruction caused by the inflammation, a lot of the parts in the joint becomes replaced by fibrous tissue, and this leads to even more limitation in the movement of the joints. It could also lead to this total destruction of the joints and then malformations. So you can see here in the wrist there is an ulnar deviation or ulnar shift of the wrist. Other deformities in the smaller joints of the hand. So this is called a boutonniere deformity. And then these other deformities that happen in the knuckles, for example, swan neck deformities. The exact cause of RA isn't known, tends to run in families, so there might be a genetic factor involved. Usually what happens is that these individuals that are prone to RA, they're fine, and then all of a sudden they get something very mild like a viral infection, and that viral infection triggers their RA. And then they'll come into the office. We've actually already talked about the pathophysiology. We've also talked about this as well. So I want to talk about the signs and symptoms, where the patient is usually a female, middle age, although it can also happen at any age. As I mentioned, the joints are swollen, especially the smaller joints of the hand, the wrists. It has to be bilateral involvement. There's morning stiffness that usually is more than half an hour, so between half an hour to an hour, and then they're able to move the joints. Movement actually decreases the pain, as opposed to osteoarthritis, the movement increases the pain or worsens the pain. Okay, and there are systemic effects. There's fatigue, anorexia, loss of weight. Because of its systemic involvement, you can find generalized lymphadenopathy or generalized enlarged lymph nodes throughout the body and generalized muscle aches. To treat this, we usually try to give the patient non-steroidal anti-inflammatory medications to treat the pain and the inflammation. We can give them cortisone sometimes if there's a severe flare of RA. Physical therapy, occupational therapy, massage, other things that are called DMARDs or disease-modifying anti-rheumatic drugs, for example, gold salts, methotrexate, and hydroxychloroquine. Hydroxychloroquine is an anti-malarial drug that was actually, it was found by accident that it also helps reduce the signs or the inflammation caused by rheumatoid arthritis. So hydroxychloroquine is actually an anti-malarial drug, but we can also use it to treat RA. We can also give immunotherapy. Just remember that all of these DMARDs, or the gold salt, methotrexate, hydroxychloroquine, and the immunotherapy, all of these, their aim is to suppress the immune system. Remember that this is an autoimmune disease. So before giving these medications, you have to get a baseline CBC, baseline kidney functions and liver functions. And provided that everything is normal, you're going to start the medication, and then you have to get a routine blood work at least every 6 months, just to make sure that there aren't any changes in their CBC or kidney and renal functions, kidney and liver functions. JRA, or juvenile rheumatoid arthritis, this is RA that happens in kids. Larger joints are affected though, so usually it's the knees and the elbows that are affected. If there's a systemic component to it, where there's fever, rash, lymph nodes that are enlarged, and even the liver is enlarged, so there's hepatomegaly, plus the joint involvement, this is called Still's disease. The second type of JRA, where we have a polyarticular inflammation, so 3 or more joints are inflamed. The third kind of JRA, where we have 4 or less joints plus uveitis. Uveitis is inflammation of the middle coat of the eye, so that includes the iris, ciliary body, and the choroid. Infectious arthritis, which is also known as septic arthritis, this develops in one single joint where there is an infection, either a bacteria. It's usually caused by a bacteria. The joint is severely red, severely swollen, very painful, decreased range of motion. Again, you have to be really unlucky to have this happen to more than one joint, but it's usually caused due to a trauma, and then a germ was introduced directly into the joint, or that this person had bacteremia, so they had a bacteria in the blood, and then it inoculated itself into one joint. The treatment is with antimicrobials, usually over a long period of time. It can even be given intra-articular. Sometimes in severe conditions we might have to surgically kind of drain the joint to get rid of the bacteria. Now for gout, also known as gouty arthritis, it results due to deposition of uric acid crystals in the joint, usually in the bigger joints of the lower limb, for example, in the toes or in the knees. Very characteristic are these white, what are called tophi. These are crystals of uric acid that have deposited. You can see them on, again, the joints, on the ears, or around the elbows. Gout is caused due to increased uric acid crystals in the blood. Uric acid comes, the source of uric acid could be either due to breakdown of protein or breakdown of DNA. So if somebody eats a lot of protein, that could increase uric acid in their blood. It could be that uric acid under normal conditions is washed out with the urine. So if a person has impaired kidneys or renal failure, they're unable to wash out the uric acid, and it keeps it in the blood, and that could lead to gout as well. Or the person has cancer and they're taking chemotherapy, and now they're breaking down a lot of cells, and that accumulation of the DNA and its metabolites can increase uric acid, leading to gout as well. Again, we have all the signs of inflammation in the joints. The treatment is try to reduce uric acid levels by different kinds of medications and to dietary and some dietary accommodations, so decrease protein intake. Diagnosis is usually by clinical picture, so physical exam, and then you want to take a sample of synovial fluid and find the uric acid crystals in it, which is very characteristic to gout. But you want to take the blood, you want to take these samples before you start any kind of medication. Next joint abnormality to talk about is another autoimmune disorder that tends to happen in males, usually between the age of 20 to 40. It's called Ankylosing spondylitis. Spondylitis means inflammation of the spine. Ankylosing means that the spine becomes like one column, means that all of the bones tend to fuse together. This is a chronic progressive inflammatory condition. It affects the sacroiliac joints, the intervertebral spaces, and the costovertebral joints. So the joints in between the backbones and the joints between the backbone and the ribs. Like I said, it's an autoimmune disease, so we're really not sure what happens. We're not sure of the exact cause of it. You can see here, this right here is the normal spine. You can see the backbones and then the discs in between. In ankylosing spondylitis, there's inflammation in between the discs and here in between these processes, the spinous process and the transverse processes. In advanced cases, all of these become fused together and they make what is called a bamboo spine. So if you look at an x-ray of a normal spine, you see again these bones and the discs in between. While here in an advanced case of ankylosing spondylitis, we have all of the bones have fused together to make what is called the bamboo spine, which is very characteristic for ankylosing. And because everything is fused together, the whole bone is now, the backbone is pretty much just one column of bone. This is the posture of this individual now. They become, they have this kind of kyphotic posture. Okay, we've talked about the progression of the condition. This again is usually a male between the age of 20 to 40. They come into the office with lower back pain that is worse in the morning. They have morning stiffness between half an hour to 45 minutes. The pain gets better as they are able to move around, so movement helps them with the pain. They could have some systemic effects like fatigue, fever, and weight loss, and uveitis. Uveitis, again, is inflammation of the middle coat or the middle tunic of the eye. On the long run, they'll have this kyphotic posture, and the treatment, you want to prevent the fusion from happening, so you have to try to diagnose them early, give them non-steroidal anti-inflammatory drugs, give them physical therapy and occupational therapy and exercise. And the best thing in ankylosing spondylitis patients is to advise them to go swimming, because that helps them exercise, especially their back muscles, without too much tension on the joints. Other inflammatory joints that happen, we've got bursitis. Remember, bursas are these little sacs of oil that are found in joints and they kind of lubricate the movement of joints. So an inflammation of this bursa is called bursitis. It's usually caused due to repetitive motion of the joint. To diagnose it is usually by physical exam. You could do an ultrasound and an MRI to diagnose them as well, although we rarely ask for an MRI to diagnose it. Usually physical exam and ultrasound are enough. It won't be found on an x-ray or a CT scan, won't pick up a bursitis. For treatment options, we ask the patient to rest the joint, give them anti-inflammatory medications. If that doesn't help, we can inject the bursa with cortisone. Synovitis, that's inflammation of the synovial membrane, leads to severe pain and restriction in the range of motion. To diagnose it, the clinical picture you have is a red, swollen, warm joint, which, if you kind of think of it, was the exact same clinical picture of septic arthritis. So to differentiate, you want to make sure you insert a needle into the joint, you take some of the synovial fluid, and you take a look at it. So you're analyzing the synovial fluid, looking for any signs of infection. Is there a germ or not? Is it septic arthritis or is it just synovitis? Treatment of synovitis is anti-inflammatory medication. If there's any underlying cause like repetitive movement, or you want to identify it and then try to treat that underlying cause. Tendinitis is inflammation of the tendons. This usually happens in the tendons of the fingers. So if you look on the extensor surface or the extensor side of your hands, you can find these tendons. if they're inflamed, there will be pain and tenderness along the course of the tendon. It usually happens because of repetitive motion. Diagnosis is by physical exam. Treatment, you want to rest the tendons, apply maybe some ice, anti-inflammatory medications, and sometimes physical therapy might be needed. In severe cases, if that doesn't help, local injection of cortisone into the tendon can help as well. Now this concludes Chapter 9.